How to apply for Medicare. It's one of the most searched terms on Google. I've looked it up for people who are turning 65, rightfully so. It's a good question. It's a little bit complex, but in this video, I'm going to address exactly how to do it and hopefully make this simpler for you. So let's get some basics out of the way. What is Medicare? Am I eligible for it? When am I eligible for it? So Medicare is federally sponsored, federally funded health insurance, okay? And there's nothing to be ashamed of about getting old and aging into Medicare because it's the best health insurance you can get in this country. It ain't even close. So let's get that settled first. It's a privilege to be able to enroll in Medicare. Most people qualify for Medicare based on age. So if you're 65, if you're a citizen, if you've paid Medicare taxes via payroll taxes for 10 plus years, or your spouse has, then that's kind of your general eligibility for Medicare in most cases. Now, if you are under age 65 and you have been on Social Security disability for 24 plus months, or I should say 25 plus months, then you'll be Medicare eligible. And if you have ESRD, that's end-stage renal disease, also known as kidney failure, or ALS, Lou Gehrig's disease, those are two chronic illnesses, two diseases that qualify you if you are under age 65. But I'm willing to bet you're probably in the 65 and up category if you're watching this. So let's focus on that. So how to enroll, when to enroll. Let's start with the how first. So how is it done? So the first thing you need to do with Medicare is get your foundational coverage in place, and that is Part A and Part B. And those are insured by the U.S. government. Quite literally, the U.S. government's your health insurance company. And you enroll in Medicare via the Social Security Administration. So they handle all this stuff for Medicare. So you go to Social Security to sign up. And you can either do it online, which credit where it's due to the government. It's pretty simple. You can do it by phone, or you could do it in person at your local Social Security office. The online route is very easy. Most of my clients have done it, and without a hitch, pretty much. So that's how you enroll in your baseline Medicare coverage. And once that is done, both A and B are enrolled, then that kind of opens the door to the rest of the equation, which is a Medicare supplement, a Medicare Advantage plan, a Part D drug plan, everything else involved with Medicare to kind of complete your coverage. So it's a two-step process to get the enrollment done. Do it with the government first to kind of get your foot in the door, get your Medicare ID card, get your Medicare number. That will allow you to sign up for all the other coverage that is necessary that most people choose from. All right, so that's how it's done. Let's now talk about when to enroll. So you're going to be in one of two camps most likely. If you are turning 65 soon, you have a decision to make, or rather you need to see if there's a decision for you to make. And that is, can you delay your Medicare enrollment or do you need to enroll right when you turn 65? And there's a pretty simple way to answer this question. If you get health insurance from a group or employer with 20 or more employees at the company, not who are enrolled in their plan or whatever, just employees at the company, 20 or more, if you get health coverage from that company, either because it's your job or it's your spouse's job, then you can delay Medicare enrollment past age 65, and you can, get around to it when either you retire or your spouse retires, or you otherwise lose that active group health insurance coverage. COBRA does not count as active group health insurance coverage, by the way. That's a big trap people fall into. So that would be one category of folks. If you can delay, then you have the option to delay. Doesn't mean you should delay. You can enroll right at age 65 if you want to, if that's what's best for you. And it's worth doing that comparison, Medicare versus my group coverage, what's better for me. If you do not fit into that first category, so you either don't have health insurance or you have bought it individually or you get it from a company with 19 or fewer employees, or you're on COBRA or some retiree medical plan, then you need to enroll in Medicare as soon as you turn age 65 because you're not going to have a pass and be able to delay it. So when can you enroll? When's the earliest you can enroll? So imagine your 65th birth month, and I like to give the example of July because it's kind of in the middle of the year. You can enroll as early as 3 months before your 65th birth month. So in the case of July, 3 months before that is April. So April 1st is the first day you can go to Social Security, say, hey, I want Medicare, let's go, do the enrollment, and be on your way. Coverage would start if you were on the earlier end, if you acted in those 3 months to sign up before your birthday, then your coverage would start at the earliest opportunity, which is the first of your 65th birth month. So in this example, I'm kind of going with July 1st is when your Medicare would start. Now, if you enroll sometime during your birth month and then up to 3 months after your birth month, then your coverage is going to be delayed until the first of the following month. So let's say you sign up on July 3rd or something like that. Then your coverage would start on August 1st. If you sign up in August, it would start on September 1st. In most cases, it makes sense to get it done on the earlier side, so it starts right at July 1st in our example here. If you miss that window, so take a step back, you've got a 7-month window to enroll in Medicare when you turn 65, if you need to do it when you turn 65. And your birth month is kind of in the middle. It's the meat in the sandwich. There is one exception for those of you who are born on the first of the month. So let's say July 1st is your birthday, to keep going with our example. You just shift the timeline back by 1 month. So you can sign up as early as March 1st. Your coverage could start as early as June 1st. And you would have until the end of September instead of the end of October to do it if you were on the late side. Okay, so that is the window of opportunity if you need to or choose to enroll in Medicare at age 65. If you go beyond that, if you miss that window, then you are going to have late penalties for enrollment. And unfortunately, you pay those once you're on Medicare. You're going to pay that late enrollment penalty forever and ever. Amen. It's irreversible. So safe to say, don't miss that window. But if you do miss the window, there is a catch-up period every year called the general enrollment period from January through March of every year. Just keep that in mind. All right, so that is when to sign up when you turn 65 if you're going to go all in on Medicare at age 65. And one thing I should note before I forget, if you get group health insurance from a smaller company, so 19 or fewer employees, you may be asking, well, should I keep both plans? My answer is no. Just go all in on Medicare, drop the group coverage. And this is because, and this is kind of the whole rule around whether or not you can delay. If you're with a small group, 19 or fewer employees, if you happen to have both Medicare and group health insurance, Medicare is going to become the primary health insurance for you. It's going to take that primary slot. The group insurance is going to take a secondary slot. And effectively, it's just wasting money if you still have the group plan. It's just not worth it. If you get a proper Medicare plan set up, it's going to be as comprehensive as you could possibly imagine, better than any group plan you've ever been on. Okay, so there's that question answered. The flip side of that is if you have a large group health plan, 20 or more employees, that group plan, if you happen to have both Medicare and a group plan, the group plan is going to be primary coverage. And Medicare takes a back seat. And so that's why it makes sense to, hey, is the group plan a better fit for me for now because I can delay, or is Medicare a better option for me and let me just go ahead and get Medicare? If you drop the group coverage, Medicare becomes primary in that case, and off you go. Again, in that situation as well, it's not worth having the group plan and full-on Medicare. It's just a waste of money. With that said, back to let's say you're in a large group and you want to delay Medicare till you retire or your spouse retires. Most people go ahead and enroll in Part A only when they turn 65 just to get it done. And that usually doesn't cause any trouble because it's free to most people. If you've worked or your spouse has worked 10 plus years and paid taxes, you're going to get Part A for free, so why not take what's free, right? It'll still be secondary coverage. It probably won't ever kick in, but you're going to have it. One thing to keep in mind, however, is if you contribute to a health savings account or an HSA, you cannot continue to put dollars into that account when you have any part of Medicare. So just keep that in mind. If you have an HSA, you want to keep contributing to it, maybe don't do the just Part A thing if you can delay. All right, so that is, those are the two groups of folks. Can you delay? Yes or no? Okay. That's how to apply for Medicare. That's a general overview. Hope that was helpful, and we'll see you in the next video.